Neurology quiz number 29. Discuss mechanism of action, uses, side effects, and dosing of topiramate or Topamax. Topiramate is indicated for focal seizures with or without secondary generalization and generalized tonic-clonic seizures. It is used in Lennox-Gastaut syndrome and is effective against myoclonic seizures but is not effective against absence seizures. It is also FDA approved for migraine prophylaxis and for weight loss in combination with phentermine. Off-label uses include cluster headache, chronic daily headache, essential tremor, and idiopathic intracranial hypertension. Mechanisms of action include antagonism of AMPA and kainate receptors, enhancement of GABA-mediated inhibition, and blockade of voltage-gated sodium channels. It is a weak inhibitor of carbonic anhydrase, but this does not contribute to its anticonvulsant efficacy. It has excellent oral bioavailability of more than 80%. Protein binding is not significant. Tmax is 2 to 4 hours. Time to steady state is 4 to 5 days. It is not extensively metabolized, and up to 70% of an oral dose is excreted unchanged in the urine. The remainder is metabolized in the liver. During monotherapy, half-life is 20 to 30 hours. In combination with enzyme-inducing AEDs, this can be reduced to 10 to 15 hours. Carbamazepine, oxcarbazepine, phenobarbital, primidone, phenytoin, and valproic acid can increase clearance and decrease levels of topiramate. Topiramate can decrease clearance of phenytoin and increase its level, while it can increase clearance of valproic acid and perampanel and decrease their levels. At doses of more than 200 milligrams per day, topiramate increases metabolism of combination hormonal contraceptives with the possibility of contraceptive failure, and additional/alternative contraceptive methods may be needed. Starting dose is 25 milligrams PO/BID for 1 week, increased by 50 milligrams per day every week until 100 milligrams PO/BID, and then increased by 100 milligrams per day every week up to 400 milligrams per day in 2 divided doses. Slow titration decreases severity of cognitive side effects. Therapeutic levels in adults are 5 to 20 milligrams per liter. Topamax is renally excreted, and with creatinine clearance less than 30, approximately 50% of the usual dose is recommended. The drug is removed by hemodialysis, and additional dose may be required after the procedure. It is metabolized in the liver, and lower doses may be necessary in the presence of liver disease. Common adverse effects are cognitive and include cognitive slowing, decreased attention and memory, word-finding difficulty, and reduced verbal fluency, as well as impaired executive function. Other effects include sedation, fatigue, dizziness/ataxia, and blurred vision. Patients can develop anorexia, nausea, perversion of taste, and weight loss. Metabolic acidosis can occur, especially in children. Hypohidrosis is also common in children and can lead to hypothermia. Metabolic acidosis, hypohidrosis, and hypothermia can be life-threatening. Uncommon side effects include paresthesias in the distal extremities, nephrolithiasis, acute bilateral secondary narrow angle closure glaucoma with impaired vision, and increased risk of valproate-associated hyperammonemic encephalopathy. Topiramate should generally not be given to patients who are on Diamox, zonisamide, or ketogenic diet, because these treatments can also predispose to metabolic acidosis and kidney stones. Patients should be encouraged to drink water liberally while on topiramate to reduce the risk of nephrolithiasis. Topiramate has been associated with a higher risk of congenital malformations than other AEDs, in particular cleft lip. Hypospadias has also been associated with topiramate. Topiramate levels may fall during pregnancy due to increased clearance, and increase in dose may be needed, requiring monitoring of serum levels. It is excreted into the breast milk, and if the drug is continued during breastfeeding, the infant should be monitored for adverse effects such as irritability and sedation, and if these occur, breastfeeding should be discontinued.